Hello. Let's see, CSP 809-409 class, Psychosocial Issues of Addictions. So I'm Dr. Chasik, and this is my first video announcement to you guys this summer. So just a few things. I like to do these video announcements every week, just to kind of keep us moving along so that you know what I'm thinking and kind of to introduce what's coming up. And so anyway, so be looking for me on Tuesdays on your announcements. So anyway, so I was super interested in reading your, so far your journal articles or your journal reflections about addiction and what your thoughts are about addiction, and then after you had gotten into the material, how maybe those thoughts had changed. And I really do appreciate when you do that, because it kind of helps you set the tone and think about what you know ahead of time, and then as you're reading or looking at that information, what fits, what doesn't fit, kind of with what the field thinks about addiction. So I did have some interesting comments. One of the things I did want to say about terminology and addiction, our author, as you know, says that really addiction is not the best word to use, that it's vague, that it really doesn't describe much. And I do agree with that in a lot of respects, because addiction is not a diagnosable condition. So it's not something that's in the DSM. We call it substance use disorders, but we do use addiction kind of in our language all the time. The American Society of Addiction Medicine, now there's another authority, right, who does say addiction is a definable term, and that's the term we should be using to categorize it. So I wanted to read the term, or the definition that they have out of, again, the ASAM, or the American Society of Addiction Medicine. This is the group that really, where like medical doctors are trained on addictions. So this is where you would go. So what they say addiction is a chronic primary disease of brain reward, motivation, memory, and related circuitry. Dysfunction in these circuits leads to characteristic biological, psychological, social, and spiritual manifestations. This is reflected in an individual pathologically pursuing reward and or relief by substance use and other behaviors. That's quite a mouthful, isn't it? And then that goes on to say, addiction is characterized by inability to consistently abstain, impairment in behavioral control, craving, diminished recognition of significant problems with one's behavior and interpersonal relationships, and a dysfunctional emotional response. Like other chronic diseases, addiction often involves cycles of relapse and remission. Without treatment or engagement in recovery activities, addiction is progressive and can result in disability or premature death. So they say addiction, that's how you define it. And definitely you can see that there's lots of things we've talked about already in this class that are in there. And so it is a chronic and progressive disease, and that's really what I wanted you to get out of that, is that addiction is a disease that has many manifestations, you know, in your psychological realm, in your physical realm, in kind of your social realm. So what is psychosocial kinds of things, that the aspect to addiction? And that's really all of the things we think about in terms of being a social person. So policies, the way that we live, other relationships. So you're going to get to hear about all that stuff up and coming. But our next module is on the brain and how addiction substances affect the brain. Super interesting information in terms of how your brain looks. You'll see some videos on what the brain looks like when it uses substances. And I did post on there on Module 2, which is a new piece of information, a PowerPoint. I got to see Dr. Nora Volkow. She is the NIDA director who does all the brain science there with addiction. She's amazing. She's in the HBO videos that you're going to see. And she had some new information and some new slides, so I put those up so you can see the brain and how it's affected. And so everything really is up on Blackboard and open for you to look at, but make sure that you check back if you work ahead, because I do put up new information such as that. All right, well, I've talked long enough. I'm glad to have you all in class. I'm glad to meet you. And, you know, one of the things that gives my life meaning, since I've asked you guys to do the same, really is my family, and actually teaching is something that is super important to me, gives me lots of meaning. So don't feel free to stop by my office if you're around, or shoot me emails, let me know what you're thinking. I love to interact with students even if it is an online class. So take care, and we'll see you next week. Bye-bye.